Hello everyone. Today we are going to discuss about coagulation pathway, activation of coagulation pathway, various steps involved in coagulation pathway activation, and different clotting factors. So there are two pathway, extrinsic and intrinsic. In extrinsic pathway, after vascular injury, tissue factor release which activate factor 7. A denotes activated factor. And factor 7 activate factor 10. In intrinsic pathway, activated factor 12 with the help of high molecular weight kallikrein and pre-kallikrein activate factor 11 which activate factor 9. Factor 9 with the help of activated factor 8 and one belligerent factor activate factor 10. After the activation of factor 10, there is a common pathway. Factor 10 with the help of activated factor 5 and calcium activate prothrombin or convert prothrombin into thrombin. Prothrombin is factor 2. Activated factor 2 is known as thrombin. Now, thrombin convert fibrinogen into fibrin monomer. Now factor 13, activated factor 13 convert these fibrin monomer into cross-linked fibrin polymer and form a clot, a permanent clot. Cross-linked fibrin polymer. So this is the process or steps involved in coagulation pathway. Now we will see various factor or various coagulation factors involved in different pathway. Coagulation factors involved in extrinsic pathway, intrinsic pathway and common pathway. After activation of factor 10, the common pathway takes place. In extrinsic pathway, factor 7. In intrinsic pathway, factor 12, factor 11, coagulation factor 9, factor 8, pre-kallikrein, high molecular weight kallikrein, high molecular weight kininogen. In common pathway, we have factor 10, factor 5, coagulation factor 2 and fibrinogen. Now we will briefly discuss about the or know about the name of the various coagulation factors. Coagulation or clotting factors. Name. First clotting factor is known as fibrinogen. Second clotting factor is known as prothrombin. Third coagulation factor is known as tissue thromboplastin. Fourth clotting factor is known as calcium, or calcium is the fourth clotting factor. Fifth coagulation factor is labile factor. Sixth clotting factor is, there is no clotting factor in sixth category, no factor. Seventh clotting factor is stable factor. Eighth clotting factor is anti-hemophilic factor. Ninth clotting factor is Christmas factor. Or plasma thromboplastin component. Plasma thromboplastin component. Factor 10 is Stewart-Prober factor. Factor 11 is known as plasma thromboplastin antecedent. Plasma thromboplastin antecedent, PTA. Factor 12 is known as Hagman factor. Factor 13 is known as fibrin stabilizing factor. Fibrin stabilizing factor. So these are 13 coagulation or clotting factors, namely factor 1 is known as fibrinogen, 2 is prothrombin, 3 is tissue thromboplastin, 4 is calcium, 5 is labile factor. There is no clotting factor at number 6. 7 is known as stable factor, 8 anti-hemophilic factor, 9 is Christmas factor or plasma thromboplastin component, 10 is Stewart-Prober factor, 11 is plasma thromboplastin antecedent, 12 Hagman factor, 13 is fibrin stabilizing factor. So that's it for today. Thank you.